For my extra credit video on hobby horsing, I chose the injury and tissue response video, and I chose a stress fracture in the foot, which is chronic, and it occurs from overuse and repetitive force on feet, which happens to these girls a lot since they're always running and jumping over barriers and other things, which puts a lot of force on their feet. The muscles around these bones become fatigued and cannot absorb any added shock from these athletes constantly running. Some symptoms are pain, swelling, tenderness, bruising, pinpoint pain, limping, and changes in running form. They can cause long-term problems if time isn't taken off, and a way to prevent stress fractures is just to make sure you're listening to your body and taking breaks when you need one, and since it's a lot of running and jumping, and you need to make sure you're eating right so that your bones stay strong. During the inflammatory response phase, the trauma leads to blood vessel rupture inside and around the site, and that creates a hematoma. Then the PMNs are recruited. Monocytes and macrophages infiltrate the site. Immune response shifts to adaptive immunity. Lymphocytes go into the fracture zone, and macrophages clear the site of dead cells and debris. The resolution of inflammation agents that created the initial response are reduced, and immune cells clear the tissue. Osteomacs, which are special macrophages in bone tissue, distribute themselves along bone lining cells and contribute to the bone homeostasis. Macrophages are polarized by anti-inflammatory cytokines. Formation of calluses are started to be created. This phase peaks within 24 to 48 hours and disappears after about a week. Some therapeutic modulates are non-weight bearing, bracing to promote healing, rest, ice for swelling, pain medication, or anti-inflammatory medication. Some outcomes of this stage are inflammation, swelling, pain, and tenderness. During the repair phase, the calluses are formed, vascular buds grow, pro-inflammatory cytokines are gone during this phase. Osteomacs are enriched at the site for bone formation, forming canopy-like structures over the osteoblasts. Therapeutic modulates would be a boot or brace, rest, and low activity level. Some outcomes are less pain and less swelling than during the inflammatory phase, so there will probably be less pain since there's less swelling. During the remodeling phase, bone mends back together and becomes completely repaired. The pro-inflammatory cytokines are very present. The balance between osteoblasts and osteoclasts create bone restoration. After a stress fracture, you can slowly get back into activity, but do not overdo it, or else you'll undo everything you just healed. Physical therapy might also be needed to strengthen the muscles around the injury site, or you could take some calcium supplements to help create stronger bones. And after the completion of the remodeling phase, the bone should be completely healed.